So I would like to introduce you to our president, Professor Vikram Datta. He has been Director Professor, Department of Neonatology at Lady Hardinge Medical College, Delhi. He has been President Nationwide Quality of Care Network and also Vice President at NNF India 2022. He has been guest editor for BMJ for 2020 to 2024 and member at editorial board. He has been expert in International Society for Health Quality in Healthcare. He has been lead in National Mentoring Group and Technical Resource Group lead, model for Lakshya Ministry of Health and Family Welfare. Member QED, Working Group Ministry of Health and Welfare. Over to you, sir.
Thank you so much, Rashi. I take great privilege and it's a proud moment for NQCN to welcome Professor Kamal Bijlani. Professor Kamal Bijlani is the Dean at School of Artificial Intelligence, Amrita Vishwavidyapeetham. He is also the Director of the AI and Medical Center at Amrita Hospital, Faridabad. He is the General Secretary of the Telemedicine Society of India, chapter of Haryana. Dr. Bijlani has over 25 years of experience in implementing AI and digital technology products and projects worldwide. And the most privileged part is that he holds 4 US patents and has co-authored over 55 Scopus Index publications relating to e-learning, mobile apps, AI image recognition, and pedagogy. He's worked for over 12 years as a technical AI lead in AI startup companies from MIT and Stanford University, and has been recently given multiple awards. Amongst them, the awards have been conferred by the FICCI Niti Aayog, and also a View project which has been used by over 12,000 for a View project, which has been used by over 12,000 colleges in India. I'm also privileged to welcome here the co-facilitator for today. Thank you so much, Dr. Bijlani, and welcome to NQCN.
Thank you, sir. Thank you.
Thank you so much, sir. Dr. Arti Pawaria needs no introduction to the NQCN family. However, as we have multiple participants from other partner organizations as well, Dr. Arti Pawaria is a clinical lead and senior consultant, Department of Pediatric Gastroenterology Hepatology at Amrita Institute of Medical Sciences, Faridabad. She's been a member of NQCN since earlier years and is currently the Joint Organizing Secretary for the International Conference on Healthcare Quality and Patient Safety, which is happening this year in September. She's member of the Core Research Committee of SPLIT, member of Governing Council of Asha Kiran Homes for Specially Abled Children, Department of Social Welfare, Government of Delhi. And she's been conferred multiple awards, including the Young Investigator Award, APA-SLD and AASLD Research Award, and the Young Investigator Travel Award for oral presentation at a meeting recently held in Washington, DC, USA. Welcome, Dr. Arti, and thank you so much for facilitating this session.
Good evening, sir. Good evening, everyone.
Later in the course of today's session, we will be also joined by Dr. Prem. Can I have sir's slide also, Rashi? Yeah, sir. So I will request, so by the time we have Dr. Prem who will be joining, I will be requesting to hand it over to Dr. Arti Pawaria, who will be giving the details regarding
Prem
the...
sir has already joined, sir.
So Prem sir has already joined. So I will just request Dr. Arti Pawaria to give an introduction to respected Prem sir.
Good evening, everyone. It's our blessings of sir only that Amrita really flourishes. And sir needs no introduction. He is the Group Medical Director and Provost, Amrita Vishwavidyapeetham. He is the President-elect of Telemedicine Society of India. And since last 20 years, he has played a pioneering leadership role for establishing telemedicine in India. He had been working for hepatology and gastroenterology for all these years. And it's only his vision that we at Amrita you are able to deliver and will continue to deliver to the healthcare in the country and across. And sir, always your blessings are with us.
Thank you so much, and a warm welcome to Dr. Prem Nair sir. Despite his busy schedule, thank you so much, sir, for joining. And we also joined by the president of the Haryana Telemedicine Society, Dr. Arti. Can you just briefly give an introduction of him also?
Dr. Puneet sir is the
Yeah.
president of Haryana Telemedicine Society. Under his guidance only, we had inaugurated the society in December 2022. He possibly had started his career long before I was born, and he really needs no introduction. He also heads our GI surgery department at Amrita Institute of Medical Sciences. And I remember the time when he told me to go to Kochi to start thinking about telemedicine, and we are here 1 year with the Haryana chapter in place, and we are happy to have the first activity of the chapter.
Thank you so much, Arti, for those lovely introductions. And I think we have a very eminent panel. We also have friends, the past president from the National Neonatology Forum, many office bearers from the Indian Academy of Pediatrics, a lot of clinician friends, senior nursing colleagues, people from the Ministry of Health, World Health Organization. The ball is all yours, Dr. Arti and Dr. Bijlani. Over to you, sir.
Thank you. Thank you. Thank you very much for the wonderful welcome and all the introductions. Thank you so much, sir, for organizing this event. And without any further ado, we will start by, I think, sharing our screen. Just give me a second to share our screen, and then we will start the session. Yeah, we wanted just very quickly, Dr. Prem Nair, to just sir, Dr. Prem, this is our first session of the telemedicine. We just wanted you to say a few words. Over to you, sir. Sir, you're muted. Sir, Dr. Prem, you're muted, sir.
How about now?
Good, I can
Can
hear
you hear me?
Yes, loud and clear.
Thank you for your warm welcome and to our webinar today on artificial intelligence. A very warm welcome to each and every one of you participating in the webinar. This is a vision propelled by innovation and driven by technology with a commitment to enhance the quality of healthcare delivery for every individual. In recent years, we have witnessed an unprecedented surge in the capabilities of artificial intelligence, transforming and revolutionizing various processes and redefining the boundaries which we once thought was impossible. So I invite you all to embark on this journey to harness the power of AI and to reimagine healthcare delivery and elevate it to greater heights. At the heart of this journey lies a simple yet profound question: how can we leverage artificial intelligence to improve the quality of healthcare? We just recently went through NABH accreditation program, and I think that the whole process can be innovated with AI and machine learning. From streamlining various administrative tasks to optimizing resource allocation, AI has the potential to revolutionize every facet of healthcare delivery. Through various algorithms, we can analyze large amounts of patient data and identify patterns and trends and insights that might otherwise be hidden from us. I urge each and every one of you to embrace the transformative potential of artificial intelligence and to dare to dream of a future where quality healthcare is not merely a privilege, but a fundamental human right. Om Amriteshwari Namaha.
Thank you so much, sir, for those words. And over to you, sir, Dr. Bijlani.
Yes. So we will have Dr. Puneet just introduce Amrita quickly, and then we will move to...
Thanks so much to Dr. Vikram Datta for this opportunity. And it's a fantastic start with quality in the telemedicine sector, because it's one way we can really leverage all the advantages of telemedicine for this. Amrita has actually been on the forefront for ages. We took part, the Amrita, the original campus, you you go down. Started in Cochin in 1998 and the Faridabad campus in 2022. And I was fortunate to be there at both the events, at the commencement of both the hospitals. Faridabad has 81 specialties and 2,300 beds with 800 doctors and healthcare professions on the annual. The basic ethos is of patient care with compassion and access with an equitable healthcare. And that's been, in the Cochin campus is really shot to the top on that. And we are all proud to be a part of it. The university itself has a lot of programs with a research focus, apart from just merely clinical care, and a lot of engineering other campuses across the country. It's a very highly rated by all standards organizations, and even the world rankings, it's in the top 50. With a lot of value-based education, thanks to our Chancellor, Sri Mata Amritanandamayi Devi, whom we lovingly call Amma. I welcome you all for this program. Thank you.
Thank you so much, sir.
Thank you, Dr. Puneet. So we will just mention the previous one.
We had in December 2023 inaugurated the Haryana chapter of telemedicine. It happens to be the 16th chapter of telemedicine, and we intend to collaborate with a lot of healthcare, including the primary, secondary, and tertiary centers, to improve the quality of healthcare in the country, especially with the fact that India still remains a resource-constrained country. But however, there is no constraint in the way healthcare can be improved and the quality care can be delivered to the one who needs. This attempt of improving upon telemedicine is one of the ways where we want the country to progress. We want that even in the periphery, somebody should be able to get to the same healthcare at least, and gets channelized through the right healthcare timely and improve the outcomes.
Okay, wonderful. Thank you, Dr. Arti. So we will just give you a brief overview of our agenda today. We are going to start, like we said, in a very hands-on session with using ChatGPT. We will tell you about AI, accuracy, privacy. Dr. Arti will lead you through a case study in clinical decision support. And together we will, show you how to use AI and ChatGPT for data analytics, research, and medical literature. Okay, so the introduction basically is that, GPT like chatbots have a huge potential. We all, I think, have used it. The basic art and science of using these, large language models like ChatGPT, the main thing is about being able to give the right set of instructions. And so we're going to see numerous examples of these. And if some of you have, have two devices by chance, and you're logged into this session with one device and you have a laptop open, that will be great. We encourage you to try, typing in these prompts while this session is going on. There are many chatbot like LLMs out there. ChatGPT is one of the earlier ones and the prominent ones. Google, Gemini, Bing, Perplexity are all others. There are some features that all of them are good at, and there is this race for AI between all these companies is so hot that things are changing every month. So we are in this game where AI is changing very rapidly. And for example, NVIDIA suddenly, because it makes the chips for AI, it became, I think, the fourth largest trillion-dollar company in the world, because of the demand for ChatGPT like all over the world. ChatGPT has all these creative capabilities, and you'll see examples of all of these today. And let me start by showing you and telling you how you can log in to ChatGPT. So you can, go to Google and basically, you just type in either ChatGPT or OpenAI. Once you do that, you will get a link. And on that link, the ChatGPT link, you can either, if you have a Gmail account, you can log in with that existing Gmail account, or you can type in your any ID that you want. Okay, so that is the process for logging into ChatGPT. If you still have questions about that, please type it into the chat, and I will show you how actually to do it at the end. We will now actually go into some of the actual prompts that we are going to, be showing you. Okay. So these are some examples of the prompts that some of these we will try out today along with all of you and show you how ChatGPT responds. So let's start with the second one here, okay? Let's say we'll tell ChatGPT to draft a WhatsApp message to a patient, Mrs. Y, to come for a blood test next Wednesday. So this, I will show you basically how to, I can copy this text, for example, here, right? And then I will also open ChatGPT here and go to the right area. Just give me a second. Yeah. Yeah. So, okay. So we will actually, we'll go in the sequence. I think we had a different example. Yeah. So the first question we can have in ChatGPT, if all of you are using ChatGPT, just type in how to greet a patient, right? So it already assumes that you're a doctor or something like that. And then it just, gives you very simple things like smile, introduce, be respectful, and things like that. Maintain eye contact and listen actively and so on. So very simple, right? Now, let's go to the next one. So the next prompt that, like I just showed you, here is, we want to draft a WhatsApp message to a patient, to come for a blood test next Wednesday. And you can try to type that in. And basically, it gives you a very nice small message, which you could type in, which you could copy into your WhatsApp, or you could, send it as a mail or do whatever you want. So it just says the message, and you can copy that message and substitute the Mrs. Y and the name and the organization here. And so this is a very simple example of communication using ChatGPT with your patients as doctors, right? Now let's look at a little more better example where it says, how do I counsel a patient for the surgery of the gallbladder? And this, the main thing here would be you have to explain the procedure and why the surgery is needed, the benefits of the surgery, the risks, the complication, the recovery, and the alternate treatment options in case they are not interested in doing this, get the consent, offer support, and follow-up support. So ChatGPT will give you, very thorough thing for everything. And sometimes it is extremely verbose at times. So, use your discrimination to edit and use whatever you need to use, basically. Now, let's take another example that maybe you can type into ChatGPT. What all should be taken care of before sending a patient for MRI, for a brain MRI, right? What all should be taken care of before sending? So here again, ChatGPT gives us an answer, says do the history review. Now, the important thing that we wanted to see if it would catch, which it has, is the screening for metallic objects, right? And it tells you that, the chains and other things that would be a potential danger because of the strong magnetic field, and the consent, pregnancy screening. So all these things, you may already know, and radiation safety, but still it gives you a gentle reminder for all the things that are there. The next prompt that I will share with you here is that my patient, Mrs. X, has stomach cancer. How do we tell her husband? How do I, as a doctor, break this news of telling her husband that, Mrs. X has stomach cancer? So here, the setting, prepare for the conversation. I should, as a doctor, know the case completely, choose the right setting, and be compassionate, and be clear also about it. So it gives you detailed communication, kind of a soft skill kind of a class here in the process. And so this 5 or 6 prompts that I just showed you, this gave you an idea of how we can, sort of, as a doctor, we can connect with the patients. So the next part here, we are going to have Dr. Arti, and she will walk you through a more case of the, yeah. So we will basically go to ChatGPT. Now, before I do that, I'll just talk a little bit about privacy and accuracy before we do that. Just give me a few minutes to talk about that. And maybe let's see. I had opened the presentation. This is not opened. Okay. Slide number 2. So privacy and accuracy, right? So here, basically, I would like to mention about privacy. Let's talk about privacy first. So, in general, just be aware that OpenAI, who builds the tool called ChatGPT, in their legal documents say that they will not ever use any of the data that we are feeding into ChatGPT for their training purposes. So according to them, even though like in ChatGPT 4, I may be, sharing a file or whatever, they will not share any of that data. So it seems like we are reasonably safe. But still, we would encourage you that when you use any patient's data, at least take out the name and the Aadhaar number or any private things before you use that patient's symptoms or whatever as a case study. But these are common things. I think we are all already aware of that, with our ethical counseling and so on, right? And so we have to basically, make sure that we are protecting patient privacy in general. The other thing I would like to mention is the accuracy. In general, ChatGPT should be viewed as a tool that is work in progress, okay? So what I mean is we can see that it can do many powerful things, but it often makes huge mistakes, and they are called as hallucinations. So that's interestingly a medical term, but it's basically making a big disaster or an error, and from a computer point of view, it's called a bug. But the word that is commonly used is called hallucination. So just be aware that just like we had a calculator as a tool, we have Google as a tool, we have ChatGPT as a tool. We are responsible finally for whatever we are doing, and we should be very careful before we commit to whatever ChatGPT is telling us. So please be extremely careful while using it. But of course, it is, in terms of giving us ease of use and productivity, it's an excellent tool. So now we'll have, these are the basic prompts that we just went through and, that we already saw. And now we will go to the section on clinical decision support. And I will request Dr. Arti to lead you through this. And you want to start with this slide, or you will show them later?
Maybe we can start with telling that there is a difference between the one which is freely available, ChatGPT 3.5, which we just used for the previous general prompts. And there is a ChatGPT 4, which is a paid version, and which generally would is the one which I have utilized for doctor's role as a clinical assistant. We will walk through. No, we have to
Arti,
see.
can we just take it to full screen, please?
Yeah. Yes, of course. We have to get to.
No, as a slideshow, Arti. Yeah.
So basically, I would start. This will have two segments. One, we are not looking at a tertiary care a doctor at a tertiary care level who wants to see and identify what are the rare cases, what could be the possibilities. That will come in the next segment. Here we are looking at somebody who's sitting at a primary health center, at a center where maybe we can have either only a clinical assistant to help these children, to help identify, or maybe to even help who to refer to and what it could be. So this segment will cater to that. So when we see, as you would have seen the previous prompt, we have to take a subscription for ChatGPT 4. And once we enter into ChatGPT 4, in general, the way it picks up literature, the way it provides information is much more medically relevant and correct. However, we still have to subject any information given through ChatGPT to our own information, and then only we can apply to the patient. But using ChatGPT, I may start by a simple question that maybe an MBBS intern or somebody who's in the periphery patient walks to the hospital and he just says a 5-year-old child has pain in the stomach. Now he doesn't know what to do. So in those situations, in case in future we are able to build some models using AI and ChatGPT, in which we can formulate and give them good data sets to give good information, that is how the future looks at. For now, when we use ChatGPT, if I've put a simple prompt as what questions to ask if a 5-year-old boy with pain in the stomach comes to the OPD. So then ChatGPT gives us appropriate information. This may not be the same in ChatGPT 3.5. That's why I'm using ChatGPT 4. And this gives the information detailed, including history, the location of the pain, the character of the pain, duration, the onset, associated symptoms, any severity of pain, and relieving aggravating factors. So now, I'm pretty sure in a country like ours, by the time such a detailed history is taken, child would have had to go to multiple healthcare and wouldn't really have gone through this detailed history. So here ChatGPT helps that the first person or the first healthcare worker where the child gets in contact with at least knows what all to ask and to encompass and to identify who needs referral, who doesn't need a referral. Similarly, it will also give you information in the physical examination, what to look for, and gives a very rough, vague differential diagnosis. Now, I have specifically did not mention any more details in the first prompt because it depends on what kind of prompt we have given. The more we give a specific prompt, the more specific the answer would be. But there is one important point to notice. Note that it is outcomes. GPT comes when we give small progressive prompt rather than telling all the information. Was a very simple prompt, as if we would say presenting illness. Now, when the ChatGPT showed that I have to ask a history and what all history I have to ask, I saw that somebody who does not know what exactly history to ask, and then we make a second prompt based on the response of the first prompt. Now it says, adding on to the prompt, the above child also has diarrhea for 20 days, loss of weight, and as associated symptoms, what are the possible differential diagnoses? Now ChatGPT becomes more specific, and it says it could be infectious gastroenteritis, it could be inflammatory bowel disease, some malabsorption syndrome, and then they will enumerate parasitic infections, food allergies intolerance, immune deficiencies, could be tuberculosis, and they're relatively fairly a good kind of a differential diagnosis as compared to a simple prompt and the differential that has produced. So this kind of training may even help training our training of our younger residents who are coming into the clinical practice. Similarly, it will also, again, as a part of it, the prompt also, it will give how to evaluate and manage and some basic test. Now, if I were to say that, do all children who come with blood in the, pain in the abdomen, diarrhea, and weight loss, should they undergo all these tests? We must again identify that it has given that it needs some evaluation, which might include, it's not saying do this. So we have to be very specific of what we need to pick from ChatGPT. Adding on, if now I have some blood tests of the patient, I would now add on the blood test because I have told ChatGPT some basic information. Now I add the information about the test which they may be carrying. The blood test shows low hemoglobin and high TTG IgA report. Immediately ChatGPT will start explaining a combination, what could happen with this investigation, with this symptomatology, and then what is the best differential diagnosis, gives an overview. Now, somebody who has never seen a celiac disease may not be very well versed, but then it will give the example so that they can explain to the patient, and then it also tells what next steps could you do. That is a very easy question of anybody asking it. It says confirmatory test will require a endoscopic biopsy of the small intestine. Refer to a pediatric gastroenterologist, dietary management follow-up. Now, again, in this, it's not that that is the end. Now I can again go back to ChatGPT for the sake of the patient, because the patient is right there at another peripheral center, and ask ChatGPT what all precautions should be taken for endoscopic biopsy of the small intestine. These are the questions which the parents are going to ask, which the patient's attendants are going to ask, and these will help healthcare workers at some point or the other. So now the ChatGPT gives much more information. It will say why is it important? What will it require? It will require an endoscope, which is a flexible tube. We have to take informed consent. There will be a pre-procedure assessment. Fasting would be required, some sedation, and during the procedure, everything is monitored. It's a sterile technique. There's no high risk of infections. After the procedure, they will monitor for recovery and what is the post-care. So now, if somebody has never seen an endoscopy, which is very even a healthcare worker or a doctor has never seen an endoscopy, he may himself has a lot of queries and questions about what the procedure is. So how is he going to ever explain it to somebody else? So when we do this, he becomes confident that, okay, these are the points. He explains it to the patient. Whatever future questions the patient may ask, what is the risk? What kind of complication? What is going to happen? These things will then be addressed to the parents right there, and that's what improves healthcare for the country. Now, if after this, they may ask again a questions of what will happen to my child if it comes out to be celiac disease. Then we can again go back to ChatGPT and ask, give a detailed diet chart for this child weighing 16 kg with celiac disease. And then it starts making a rough diet chart. Now, if you look at this diet chart, this is not the one which any healthcare worker or we provided to the patient. So even though ChatGPT gave this in this form, we can still further refine it. When we refine it, we'll say this child is vegetarian. Update the diet chart in a short tabular format with 20 lines. That's how the ChatGPT will start refining itself and giving what is relevant, appropriate, and even applicable to the healthcare personnel in the country or anywhere. And that's what the value is. The question will never arise who will replace it. The question will arise how is it going to help us save this time in the busy clinics, in the busy OPDs, and still give good outcome to our patients. We would rather give a diet chart rather than only sending of the patient with half-hearted information. So this was an example of how a simple history of presenting illness can lead to an entire curve of diagnosing a patient, going to the differential diagnosis. And we have to remember that in this entire exercise, the one who does it, even if a first year JR does it, he learns a lot of things which he may not be learning, right for one child. So there's always a learning curve. Gradually, when people are used to learning this way, this will only augment. And hence, these kind of things can be used for finally building up a good data set where the answers can be further refined. There can be data sets which are fed in by appropriate guidelines which has been published. And finally, ChatGPT can also be taught to start answering much more in detail, which is the future for how AI will help healthcare.
Wonderful. So we will take a short few minutes here to answer any questions. Maybe just I know there are already some questions in the chat and the Q&A. So
I think I think very quickly I'll be posing these questions to you, and you could quickly we could answer them because they are very short questions. So basically, there's a question from Dr. Suhasini. She says, does ChatGPT provide with statistics on morbidity and mortality associated with a particular surgical procedure? And if yes, how reliable it is?
okay, I had opened the Q&A. There were 10 questions there.
Yeah.
Okay, I guess you've opened
Yeah.
the
Q&A only, sir. I'm reading them out to you for your convenience. You could just answer them.
So possibly the answer to that question will come in the form that ChatGPT has to utilize some literature behind to tell that a specific procedure is having this much of morbidity risk and this much of mortality, depending on how much of medical literature it has. So again, once the prompts are of such a way that either we tell that the patient has to undergo pediatric neurosurgery, this specific procedure, what are the risks associated, what is the literature, what are the literature or maybe a few reference articles for this. Once you create those reference articles, then you tell ChatGPT that, based on all these review articles, let me know what is the summaries. Or finally, I have 10 articles which we can upload to ChatGPT, and we'll come in that in the next segment. Then it is going to summarize what is already there in the literature. So where the healthcare or the doctor gets helped is manually doing it, reading all through. That is saved, and that is what at present ChatGPT can do to save our time and also make it more reliable as an information and crisp and ready information is provided. But definitely the data set we have to provide. They cannot say which articles will say what. That we have to provide. They may give us an example of those articles. We will find them authentic or not and then give it back to them saying you please summarize them and then tabulate the more complication rate according to all these procedures as per the papers that has been fed back to ChatGPT.
So, Dr. Arti, I would just like to add here that if you look at the Bing, which is a Microsoft version of this, which has ChatGPT already integrated it into its browser. If you put these questions into it, it will go surf the web and it will then provide you some links to, that data set. And you could directly click on those links and you could be directly taken to the source documents. You could download those source documents and you could get them back to ChatGPT 4, put them, and all of these documents can be summarized and that could directly get you. So that saves you even the trouble of perusing and trying to look at PubMed or something. There's another question, sir, from Sachin Gupta. He wants to ask, is there any experience with the paged version of Google Gemini? I want to take subscription of any one of Gemini or Chat GPT, any comparison of both.
Yeah, this is a live question. This process between who's better and how much better is going to be a constant tug of war actually. So we at this time today, I've personally taken ChatGPT. That's all I can say. I can tell you only what decision I have made with my learning. But, I'm also learning Bard at the same time. And earlier, the main differences between the two was that ChatGPT earlier did not have access to the latest data. That was one of the major drawbacks of ChatGPT. But from what I'm hearing now, and which I need to completely confirm, not in theory, what is being written on the internet between Google and Microsoft and OpenAI, we really, there is so much marketing hype that it is hard to believe anything fully until you actually try it yourself. So that's, what we are doing here at Amrita. We have a big AI team and we try out these tools. And I would like to say, Dr. Sachin, thank you for your question, but I cannot give you a firm answer, but I would give the edge to ChatGPT today. But if you ask me a month later, my answer may change, So that's all I can tell you today.
I think that answers this question. Somebody is asking the cost. I think we would not be telling you the cost here. You could directly go on the website, though we all subscribe to it. Yeah, it's I know the cost, but
$23 or around
but we are not
1,200
mentioning it here, sir, officially. Okay. So Sunita Manchanda has another question. But if patients come with self-diagnosis, self-treatment, etc., we are left with counseling only guided by patient. Am I right? And how to know if ChatGPT is hallucinating. Himesh Verman from NIGRIMS, he's our colleague. He's head of the Department of Neonatology at NIGRIMS in Shillong. Yeah. So how to know if ChatGPT is hallucinating?
To know if ChatGPT hallucinating is like, saying, how do I know if I go to a Google link if something is wrong, right? I mean, it's a difficult question. Then I mean that is the the authenticity of the doctor. Finally the doctor is the expert. The ChatGPT is giving you some information, but even sometimes ChatGPT has given you some reference papers and 2 months back, and they turned out to be, incorrect papers, So when I get a paper or some information on ChatGPT, it is my responsibility, if it is critical, to authenticate it, from a trusted medical source. So the trusted medical sources, whatever you trust and whether it is PubMed or, let's say Google Scholar or whatever you use today, which are being used by a lot of people, those are the trusted sources. We should, check whatever it is saying against those. That's the only way to really know.
So, sir, for want of time, I'll just take two very quick questions, and I think the next part is going to address them. There's a question from Professor Mukesh Dhankar at Kalavati Saran. He says, can ChatGPT do statistical test? And Parul Dubey says, if used in the initial stage of residency training, will it not blunt the imagination and problem-solving abilities? So I think there's a question carved out for both of you to address in the subsequent session on research part. So over to you, sir.
Yeah, I'd just like to, one small thing which I wanted to mention, that we would, for practical purposes, now we are moving from ChatGPT 3.5 to 4 in this session. Okay. whatever we are going to do, you can, the same user ID, if you buy one, if you have a club of 10, 15, 20, 30 people, you can all share the same ID if you're using it sparingly and not too often. So, I would say that, create some small groups among you, even if you're students, and it'll be 50 rupees a month or something like that, which we can all afford, I'm sure. So strongly recommend going to ChatGPT for everyone. I think there were 2, 3 questions along that lines.
Research caliber of students who lose their imagination early, like we had a DM student coming up with a literature review done with the ChatGPT I was mentioning to you yesterday.
So, I don't know, I mean, this availability, like, when I was bachelor student, that time people would say, oh, should you use a calculator, then, I mean, that was, because you will lose all your arithmetic multiplication table abilities. And it is true. Many people nowadays have lost the ability to multiply. But, does it matter? I mean, then the mobile came and there are so many tools associated with the mobile, and the mobile was not allowed in college. Now it is. So I think life will go on. These tools are available online free. Half the people are using them. We need to create a level playing field so that everyone is aware of the power of them, the productivity of them, and the risks associated of them. So we need to create massive awareness. Yes, some people their English writing skills may deteriorate because they want, but on the other hand, what is the core thing that matters? That we should focus on.
Thank you so much. I think we are flooded with questions, sir. One of the facilitators can be addressing the questions. We will be proceeding ahead for limitations of time and going ahead with the rest of the presentation.
Yes,
over to you,
yes.
Dr. Kamal and Dr. Arti, please.
Thank you. Yeah. So we'll go forward with the second part of our session right now. And here, basically, I think we have already done the. We are going to go. This is what Dr. Arti just showed, and so we're going to go to the data analysis part now. And in the data analysis part, we will have Dr. Arti sort of, tell you about an Excel file with data that she has, and she will give you an overview of that Excel file. And then to that Excel file, we will ask all these questions, and that will give you an understanding how we can use ChatGPT for data analysis. We will not be able to do too much advanced statistical analysis today, though ChatGPT can do it, but it will give you some idea of the thing. So here, what we have done is that we created one was it the pediatric or the Excel? No, that was the old one. Was it in? Do I have to go to the ask your PDF first, Pawan?
Age and gender demographic.
Huh?
Age and gender demographic.
Come here, Pawan.
This one. Yeah. So this is a data from one of my work where there was an Excel sheet.
Let me open the Excel. Yeah, good.
So this is an Excel sheet which we normally would have for any kind of dissertations. So one important thing is that, as sir has rightly said, that we should be masking the name and the main details, and that can be done in a systematic manner, keeping the original file and masking this primary data. That is definitely of prime importance. We'll start because it is a big file, as all of our residents, when we do a big file, which is very difficult to handle. And of course, a lot of statistics can be done by Excel and other methods, but we would want to show what initially basic things ChatGPT can do. So even as basic as if this is the column, the E column is of age in months. So we what we have to do is that we open the ChatGPT 4. We have this one also we have used in ChatGPT 4. This, this. So what we have to do is that we have to first upload. The ChatGPT 4 has multiple plugins. A lot of plugins comes along with the ChatGPT 4 when we buy a subscription. And in this, you would see that we have added an Excel evaluator. Similarly, there are multiple plugins which are used. Many of them will come free once you take a subscription with the ChatGPT 4. So the first thing is that whatever the Excel sheet is, we have to upload it here. So if we go through original, there will be a attachment sign that we see in the emails. We attach it like similar to this. We just have to go browse and attach the sheet that we wanted. And we don't even have to tell which column has age or gender as long as we give simple instructions to them. So for example, in this one, I had given a prompt like give demographic profile, which includes the age and gender. For the gender, because I've coded it there, I'll point here. For the gender, boy is 1 and girl is 2. Next other sentence that I want to write before it makes it is break up the age group as follows: 1 year, 1 to 2 years, 2 to 5 years, 5 to 10 years, and more than 10 years. This is a basic thing which all of us would require to publish our results. And the first one I'm not showing because there was a error with the prompt itself. But then what I said, it will, the ChatGPT will redefine for me. I basically put it in a prompt language, telegraphic forms, but whatever it understood, it is going to tell me that the age groups you specified are this, and this. Given the age in the latest data set, which is provided in months, the characterization would be this, and this. So this is also an intelligent thing that I put it in years, but my data is in months, and ChatGPT picked it up. And then they would give a table like this. So this would take hardly 30 seconds for it to make an entire table. This entire thing can be copied and taken back to our Word files and where we prepare our tables and our manuscript. Now with this, I know that I would also need a bar chart for my work. So I will not repeat everything. I will just work as if I'm talking to ChatGPT 4. So I'll say, show a bar chart for age and gender from the values in the table above. And then it is going to give me this table in another 30 seconds. So primarily, when we look at the research and the way it should help our residents, it's not going to help the resident. It's making the entire Excel sheet giving to us and saying, please do all the statistical analysis, I'll come down. That's not what ChatGPT 4 is going to do, or nothing is going to do that, but we have to be specific in our what we want out of that. From that entire big table, it can make every small prompts, everything it can make, even the highest advanced statistical test, but not at the same time. We have to tell, now you do this and now you do that. So this graph was made. Going ahead, now I'll go back to the Excel sheet and I realize that apart from all the complications, there was a table here which said weight and height, which I've highlighted in yellow. And by my basic things, I have also had weight Z scores and height Z scores. But I wanted to challenge ChatGPT saying, will it understand Z scores? So what prompt I gave, this one, yeah. So what prompt I gave this time is, calculate the median weight and height Z scores for the above categories. But I did not tell which column. I did not even ask ChatGPT for, do you know Z scores, or where is the reference for the Z scores? I did not have this because this big ChatGPT 4, it has the basic data for Z scores. But yes, every prompt that we give, if the answer is not correct, we have to rephrase our prompt in a way which is easier for it to understand, and then go next step one by one, and then start interacting with ChatGPT 4 as if we are interacting with another person sitting here. That is what it should be. It should not be that you are a computer, I give you everything, you just do it and bring it back to me. So once I said it, For a small one sentence from my side, it said, to calculate the median weight and height Z score for the specified age categories, I will focus on the relevant columns in the data set. And it identified the Z score data. It also said the WHZ possibly represents weight for height Z score. That was also not given to me, as in my first prompt I had given gender, 1 is boys and 2 is girls. This one I did not give, but it identified from the data, and then it calculated in the same prompt. I didn't have to do it again. It just said, these are your median weight Z scores and height Z score for these ages. So these are those additional simple things which we can give. Between the age of 5 to 10 years, it is not giving me a value because I did not use the Z score and I used BMI in those. So it is going to give me those details in a shorter span where we can save our time, and maybe then with all the data, we can sit down and think, is there a beneficial effect of subgroup analysis? If I do this, will the outcome be better? So again, ChatGPT is not giving us result, but it is giving us some basic information where we becomes easier for us to reanalyze and rethink of what our data is.
Wonderful. So that sort of gives you an idea of what we have planned for the statistical analysis today. And of course, this can go on much deeper and much longer, and we'll hopefully do an advanced or a solid workshop soon where we will go much deeper. So the next part of the presentation will show you quickly how ChatGPT can help you as a research assistant. And we will for this one, ChatGPT has certain things what are called as plugins. So these plugins act extra power for various functions. So there is a plugin for, one is called Ask Your PDF Research Assistant. And that's the plugin in ChatGPT 4 that we have used for today's presentation. And that's what we will now share with you. So these are some of the prompts that we are going to show you basically. And we will now go to the conversation that we have had with ChatGPT just a few minutes back. So it's any conversation that we have, by the way. I clicked on the link right now. So it's opening that link that I just clicked on. It's taking some time. Okay, there it is. So basically, this plugin is being used. And Dr. Arti will just explain the prompts that we have here, starting with show the research papers. Go ahead.
So for this, for the actual research, which possibly would be needed by somebody writing papers or reviewing the literature in depth and authentic information, the first important thing, as Sir said, would be to go to the Ask Your PDF Research Assistant, because their screening is much different from what a ChatGPT 3.5 would do, or even a 4 would do without a plugin. So it is important where we are typing the prompt. So I started with as simple a prompt as show the research papers on neonatal cholestasis secondary to bile acid synthetic defects. Now, these are few things which we feel are rare, and hence I'm utilizing these things here for very specific areas which we want to do. Now, when I said a random prompt without much information, if the question is not precise, the answer will also not be precise. This is an important thing to note. And then what even an Ask Your PDF Research Assistant did is that it gave me 6 papers by authors and details in this. And as far as I know from the specialty, they are authentic papers which has been published by the same authors. However, I wanted to know whether my research review of literature has been adequate or not. What if there are other new articles? What if there are newer articles? And you realize that their last article here is 2020. That is the latest article which is there. And the rest are of little earlier years. So I will now make a better prompt according to my need and made a prompt like show 10 research papers of last 5 years on the same topic on neonatal cholestasis secondary to bilateral synthetic defects. And here it gives me the same thing. So that means ask my PDF could have given me a better answer, but because my prompt was not specific, my answer was not specific. So now it gives 10 articles in the last 5 years. This is where it is going to help, especially residents in your training or specialization, where this will save that time of going to PubMed and identifying them one by one. The next thing which I would wanted to know, because I had a kind of a bibliography here, the next thing we have to do is turn them into Vancouver style. What I did is I just put another prompt saying arrange the above references in Vancouver format, and it immediately did. So I put the first one as this, and it immediately did. I could have done it for all. I could have just say arrange all the above references in Vancouver's, and this is what would save time. Now, the next thing, while writing a paper, I should know what data I am citing in my review article if I have to utilize these articles to write. So again, the prompt should not be that based on, rather than asking 10, I could have said, okay, write 30 articles. Find 30 articles for the review, and then you summarize everything and make a review paper. That's not how ChatGPT would work. It is going to help us in those actions which are potentially just grammatical, identifying, summarizing English from 2000 words to 500 words. But what is the next? It's not going to tell us. So I would then give a prompt that for the first paper, write 8 to 10 line summary with focus on the major results of the research. Now, this I know by our own, the way we graduate with research, that of course I have to write only major points, and then it will give me this. Now, having this paragraph with a cited reference is good enough work for a medical student while writing their research. So that is how ChatGPT can authentically help us. So after this, there is a paper, an original article that I had written. It's an original research paper that I had written, and I wanted to ask ChatGPT, is everything okay with the paper, the entire paper? I've written an original article. Can you just suggest how to improve it? Now, if you ask a random question like this, it's not trained to understand what the paper is. It will just give you, again, standard guidelines saying you should have IRB clearance, you should have stats, you should have discussions. These are not of value to us when we write research. So another form of writing this could go that if I have to submit this paper to a specific journal, which I've thought of submitting it, I will identify the author guidelines of that article, of that journal, pull that PDF, add it to the ChatGPT. Like here I've put author guidelines. I've identified author guidelines for Journal of Pediatric Gastroenterology and Nutrition, and I've put my paper there, and then asked the ChatGPT that based on the author guidelines, can you identify any deviations in these research papers from those guidelines? So these, I would not say that it would do everything same, but random things, it may just say that your manuscript length exceeded the specific limits, or if there are any other further details. But definitely, it is not going to tell us to correct everything. Grammatically, it may do. Other important thing is that when we do these, we put these papers, another important thing which I've realized is if you give it in the form of a PDF or a Word, first of all, it should always be a PDF when we upload it. So if you have a Word file, you have to convert into PDF and then upload. Otherwise, there are times when we like this entire paper, when we put this entire paper, copy this entire paper, original article, which has to be done very carefully. then it will probably bring out few grammatical mistakes or few discrepancies, but obviously that is not authentic, and that is not what ChatGPT is here for right now, till it gets into a refined view.
Yes, so I think Dr. Arti is giving you an excellent overview of how to, have ChatGPT, help you in research. One of the main thing was, you can with ChatGPT 4, I think that should be more precise. You can get some, research papers in a very quick way, very, in your specialized field. And I think the main thing that Dr. Arti has been emphasizing is that when you're working with ChatGPT, make the prompts very small and precise and functional. So, if you say do A and B and C and D, you will get very vague and ambiguous answers. So always, you can use it to write your PhD or your thesis, but then, if you just say go to this, if you write up something, let's say somebody was writing a thesis, they write up their section in their own language, and then they give that 20 lines to ChatGPT and say, look at this text which I have written on this topic, does it look good? Then ChatGPT will give you some good review and a better English with spelling and grammar. But the original effort usually should come from the person themselves. Because if you tell ChatGPT to write something directly, it's often very verbose and superfluous also. So our general recommendation is break down the tasks into very tiny tasks. That way you will get more effectiveness. Okay, I think the last part that we briefly want to show you, and then we may close this session. What was this? Yeah, okay. So this last part that we will show you is basically, in the medical area or in any area for that matter, as professionals, as we work, there are some huge documents, especially like, let's say the legal industry, there are huge documents of hundreds, thousands of pages, 50 years old, 20 years old, and then you need, 2 paragraphs from that. How do you get that? So that is something that ChatGPT is really, really good at. So here, for example, we downloaded the ICMR guidelines for antimicrobial use, and that is a 300-400 page document, right? And then from that document, you can ask 2 specific questions, and then ChatGPT will just give you that particular specific information, okay? So we'll just demonstrate this as the last thing today, and then we'll, so you can see that here we have, uploaded the document called Treatment Guidelines 2019. And then, we asked, suggest antibiotic for osteoarthritis. And Dr. Arti can briefly describe.
See, what happened in this PDF is that initially we asked them, we gave a doc, that's how you would see that we're talking about osteoarthritis, but it came peritonsillar abscess. But why it happened is because when we had uploaded the PDF, we asked them for an antibiotics for meningitis. So basically this prompt is the second prompt. Our first prompt was suggest an antibiotic for meningitis when the article did not have a meningitis treatment. So it started saying something else. So we realized that it also said that the article does not give more information towards it. And hence then we said, okay, give the latest guidelines for managing sepsis in a patient with liver disease based on the ICMR guidelines, and then it gave us a diagnosis of whatever about liver managing sepsis in a liver disease patient, whatever is there in that ICMR guidelines of 300 pages. It made a summary of it, and very rightly it made a summary of the 1 hour golden time and identifying how much lactase to give, which IV fluids to withhold, and how much the pressure to be maintained. So overall, I would not say that we are going to directly use this to treat the patient. But yes, while we write something, or while we have to cite a 300-page document as a summary of something in only liver disease, that is where ChatGPT can identify. So we'll have to break our research work into multiple small folders, and then use ChatGPT to just save our time of scrolling through an article and picking them and citing them.
Okay, wonderful. So I think this is mostly what we wanted to share today. And, I would just like to share with all of you that I think till around 2 months back, Dr. Arti had not used ChatGPT. And I think that is very, you can see how passionate she is today about using ChatGPT and other AI tools. She was very technologically, staying away from technology, and but luckily here at Amrita, within the hospital, we have an AI team. So we have, converted her, if I may say that.
So that is very true that we may all understand that by the time I type in the ChatGPT, I may just go through a review article and do it, but there's always a limit to how much and how many can you review in a day. We may review 10, we may review 20, but if we know the art of reviewing many and we have the baseline knowledge of how to authenticate in our own specialties, I think that is where AI is going to help. Definitely the monotonous time in paper writing, bibliography and things like this, it is going to help, but definitely not that somebody goes and types, these are the information, give me a prepared case report. That's not what AI would do. And that's not what I'm pretty sure half the people who really wish to use AI in good terms would ever do. So I believe that at this we would end it from our side, and over to you, Vikram sir.
Thank you so much. I think both of you mesmerizing presentation, sir and Dr. Arti. In fact, I'm sure nearly 200 plus people attending it, and still at the over nearly 90 minutes into the presentation. I think they're still all around. Very quickly, sir, 40 question and answers. I'm sure we will take a printout of most of them and send it across to you. But some of the ones which are quite interesting, I would quickly take it. Neetu Taneja wants to know what about plagiarism if we use ChatGPT for research. One line rapid fire questions to both of you.
Yeah. So, I mean, that whole area, again, is work in progress from a policy matter, from a legal matter. And, we should just keep our eyes and ears open as to, what policies are made. In general, from if you use ChatGPT with your original material and there is no plagiarism as such, but, some journals say that if you use ChatGPT to write something, then you should mention it within the paper. So I would say, please just check depending upon the particular journal that you're working on.
And that's what exactly Mukesh Dhankad is also asking. All journals asked now to declare that AI is not used. So if you've a journal which says you to declare that you've not used AI, I think you should be clarifying it with the editorial board or getting back to the team. And you should be very, very honest. It should not be that you've used AI and you're not mentioning it if the journal asks you to mention it. Now there is another question, sir. Is there any limit on plugin numbers in ChatGPT? And the same question from my side also, sir. I've been using this for nearly a year plus now. I want to know from you that I've been using ChatGPT 4 for quite some time. Whether we have to put in the plugins, or it will automatically take like the PDF one which Arti was showing right now for the research articles and the Excel analyzer also. I would like to know, do we need to get these free plugins or we have to pay extra for them, or from where do we install them into ChatGPT 4?
So they're already in ChatGPT 4. In fact, I could just quickly, show you.
Yeah.
When you are in ChatGPT 4 at the very top, there is this, oh, I'm not sharing my screen. Can you see my screen?
Yeah. Please go ahead, sir.
So on the top left, you see this ChatGPT, right?
Yeah.
So when I click that ChatGPT 4, see it says three things: GPT-4, GPT 3.5, and plugins, right? When I click on plugins, then now it says ChatGPT plugins at the top. And then I can go ahead and the plugins are already there. And basically the you need to then
The one in the left side showing
yeah.
Yeah, at the left of the
बोलो
सर इसके बगल में
because of
we have
the
to
thing.
remove that bar. That bar is
उसको नीचे लो
we can close that bar down.
No, no,
Or
no.
maybe close that bar completely. It is hindering the yeah, it is hindering.
That bar, no? No, this bar is not good.
There's a bar on the screen. We're just trying to get it, yes.
So here on the top left, can you see those things I was trying to remove? It was covering it, right? So ChatGPT allows you here now you can see the plugins. When I clicked on that drop down, Dr. Datta, you can see that, right?
Yeah.
So I can, basically I can, scroll down these plugins, and it allows you to use any three plugins.
Okay.
So, all these plugins are there. Ask Your PDF Pro. That's probably one of the ones that we were using. And Google Sheet, Access Google Sheet. That's also, AI data analyst. So, three plugins are free with your ChatGPT 4 account.
So if I were to quickly, for the benefit of the medical students who are attending here and the nursing students, if I were to ask for a basic, Excel-based analysis, a basic analysis with some, generation of figures, which one would you recommend out of these plugins?
Oh, I'll get back to you, sir, because I don't want, we have several users here who have used, which one have you used for Excel, Pawan, for the R comparison?
The same GPT-4, no special.
You did not use any plugin for that?
GPT-4 is enough for advanced data analytics, so it can perform any.
So Pawan is saying, he just used ChatGPT-4, but I will, supplement that answer because the AI data analyst and Access Google Sheet plugins are there. But pretty advanced things can be done by ChatGPT-4 itself. In fact, our team here internally, the AI team, was doing a comparison between ChatGPT-4 and another AI software called R. And they're finding that ChatGPT is more effective overall.
Another very quick question. Thank you so much for that demonstration. Is from Soumya. She says, "Can plagiarism be checked through ChatGPT?" I think that is something which we require very, costly, authenticate, etc. Quite costly pieces of software. So can medical teachers, nursing teachers, and routinely journal teams, can they use this to check plagiarism?
Yes. Plagiarism from ChatGPT-4, you're meaning, or plagiarism from anywhere?
So for example, a submitted piece of document to be checked, like it's suppose a review of a literature or something like that, and we want to check for plagiarism content.
Our whole university uses a standard tool. I'll get back to you with the name, Dr. Datta.
He's saying to avoid that. He's saying to avoid that.
Right, the ChatGPT cannot check plagiarism as there's no specific software to check.
Yeah. So authenticate, I think, is normally what
there are very specific softwares built only for checking plagiarism.
Yeah, definitely. So we are using that.
Yeah. That is better than ChatGPT, I think.
Okay. So there are some more questions, I think, but Parul Dubey wants to know something to do with the feedback and the subsequent sessions which we have planned. She wants to know that Will we have some other online courses on AI for medical professionals? And does your institution have some online courses on AI for medical professionals?
In
I
fact,
think
we are
yeah.
just about to launch that actually, and we will have a set of online classes for medical professionals, and definitely we will be starting that very soon, and working along with Dr. Datta to let all of you know about it. So we will get back to you with the dates and the times of that online short-term medical courses that we will conduct.
Yeah. Thank you so much, sir. Last question I'm taking is from Bipin Kumar Rathore. Something very close to our mind in our NICUs, PICUs, as well as adult ICUs and inpatient settings. We collect a lot of data, sir, these days in the Excel forms. Often there's a lot of duplication of data. So we want to know, in fact, I also want to know, and Bipin also wants to know the same thing. Where can you apply AI technology to automate clinical documentation and search large patient documents to draw valid conclusions and predict ends, etc.? I think that would be very, very meaningful because most of the hospitals, including the government hospitals, don't have a lot of access to data analysts and other things. The resident doctors and the nurses who keying in large amounts of data every day. But nobody really looks at that data, and that is what really bothers us. The data is getting keyed, but how do we analyze it and in absence? So can the AI come to our rescue in that? And can we
Definitely,
in
sir.
subsequent sections maybe plan something about that type of thing, some hands-on, maybe short demonstration for clinical teams?
Surely. I think as long as the data is, basically this whole data thing, managing data for AI is part of our course actually. And basically, there is unstructured data and there is structured data. So many things that we all need to be aware of is how to when we are getting data to make sure that it is stored in a structured format. And then, if it is stored in a structured format, let's say like Excel or something like that, if you just have a lot of text, for example, like the doctors will type some text, but if it is kept in random places, then it is unstructured. But if it is, managed and kept in certain formats and tables and so on, which we will explain in our online course. But we could talk about this further. Yes, definitely we can help. AI technology can be applied, but some basic rules need to be followed for storing this data. Some good practices, basically. Yeah.
So one last question. Suppose this question is very interesting. How does a person know that the submitted piece of document or analysis is created by AI? According to me, if you directly submit it back to the AI, it tells you that it is generated by the AI. That's what I do normally. I've let out a secret which students may know now. But if you submit that piece, you just cut and paste it and put it back into that generative AI form. It normally tells me whether it is generated by AI. But Dr. Kamal, I think, is an expert, and Arti besides him, and pass on this question to you.
Sure.
रिफास्ट कर देंगे क्लीन बोर्ड से तो नहीं पसंद
क्या
जो जनरेट हुआ चैट जीपीटी से उसको फिर दूसरे सॉफ्टवेयर से रीपास कर देंगे तो चैट जीपीटी नहीं पहचानता
Right. So the students, we have AI students, and that is a challenge, So what the students do is, they will get the answer of the chat GPT and they will, if
Pass it
they
through the humanized versions. Yeah,
they used another tool. If I take chat GPT output and I give it to Perplexity and say reformat this, it will. And then the putting it back or anything like that will not work, and that is the challenge. I mean, so again, it is going to be very, very difficult.
A lot of ethical issues are going to be there, I think, but we should, at the topmost, we should try and use it for helping us rather than using it for other options. I know there are many questions, but unfortunately, we're running short of time, and Dr. Kamal also has an preoccupation, and we agreed for a 90-minute session despite normally 60 minutes. This shows a tremendous interest most of you have had in this. And I'm sure we've discussed with Sir and his team that we will be having subsequent sessions in a run-up to our conference, and allow me to share my screen here. And I take this opportunity to invite all of you to the third International Conference on Healthcare Quality and Patient Safety, which is being jointly organized by Amrita and NQCN. And this conference will be hosted at Amrita Institute of Medical Sciences, Faridabad, and Lady Hardinge Medical College, New Delhi. The dates are 7th and 8th September. I request you to kindly block your dates into it. And subsequent to this, you can scan this QR code and get the early bird registration. Also done, you can just take a screenshot and you could register early at the early bird rates. For this is going to be an exciting, session. With this, I take this opportunity to take some time to please fill the feedback form. It's very, very essential for us to improve the session. For people who would like to have a certificate of attendance for this, subsequent to the feedback, we will be taking you to the QR code for the certification. For certificate of participation, you can just scan on this link and you will be taken to the certificate of participation page. The NQCN office will be mailing you the certificate of participation for today's session. So that brings us to the close of this wonderful evening and this phenomenal, inspiring session with Dr. Kamal, Dr. Arti, and lots of stalwarts who are present with us in the panel. I'm sure, friends, it would have fired each one of us and our imagination. And today, I'm sure Dr. Kamal and Dr. Arti is going to be a long night for most of the people. They're going to be downloading OpenAI and is going to, get a lot of hits from Delhi and around and on all around India and the Southeast Asia region. And I'm sure we will be using, especially for clinical decision support, like Arti beautifully showed, for simple data analysis as we learn, and then subsequently into research mode. And the most important part is the communication part, the checklist-based approach, which the GPT showed us. Friends, there would be a lot of questions in your mind related to the ethics, related to privacy, related to data security, related to, a lot of aspects, how we can use it for betterment, but at the same time, we have to be wary of any new technology. We have to first master it. And remember, our own internal ethics are going to be the guiding light in this. There's nobody to watch us. When we do it, we as researchers, as academicians, are going to be guided by our own internal conscience. And we are going to use it to ease to give us more time to effectively utilize for the welfare of our patients and for welfare of the humankind as a race. So with that, I promise that we will be back with subsequent sessions like Dr. Kamal and Dr. Arti have already communicated. And in our conference, we plan to have a physical, one-day full workshop on this. And if permitted, we will like to have similar sessions, maybe a physical session much before if you mentioned in the feedback form. So with that, thank you so much, the entire team at Amrita Faridabad, Amrita Kochi, especially Prem Nair sir, for despite such a hectic and busy schedule, all the office bearers of Telemedicine Society of India, including the Haryana chapter, very, graciously, you have co-hosted it, and NQCN and its communities of practice, which is supported by WHO CRO, and all the participants for staying up close to your dinner time. I'm sure this evening is going to be very enlightening. Thank you so much. Any last comments, Kamal sir? Over to you.
Thank you. Thank you, Dr. Datta, for organizing this initiative. And I think, we all, as a community, we need to work as a team, like you said, to improve healthcare for India. We are all here. So I think a lot of this technology can be used. Of course, we need to be careful. I think we are very proud to have, Dr. Arti, who has learned this very quickly, as you can see, and she was able to make these extraordinary presentations, and she was not even willing to use any of these AI tools, 8 to 10 weeks back. So we can see the transformation and the power of these tools, and I will let her speak for herself.
Thank you, everyone, for being there. And I would just conclude it with saying that, this is a time that has come where we all can work together to actually improve the systems out and improve the outcomes in majority of the firms in the country. And it is just a beginning. We all just need to stick to our ethics, stick to what AI is giving you, and with that human angle. And that's what's going to get the country up in the healthcare that is. Thank you. Thank you.
So, Dr. Puneet, just a few words.
Yeah.
These are extremely exciting times. And I think we, to answer that, partly that question, whether it's going to help students or not, it's definitely, I think they don't need to spend crap time on a lot of the things which we feel is important, like the calculating skills. So I think we're going to see a lot more. I think India's at the vanguard of this revolution. So I think we hope that it really pushes research, clinical care, and all that side by side. Thank you.
Thank you so much. In fact, I think it has been a really phenomenal time for all of us and a very lively and interactive session. I'm sure most of the people will take time and they will get better. And I'm sure in the next session, you'll have lots of users, experimenting with the advanced skills. Thank you so much. Have a great evening, all of you. Good night and goodbye from NQCN.
Thank you.
Thank you. Thank you, sir.